2, 1. Adam Hutchison, MD of Belmont Healthcare. Welcome back to the Care Home Show.
Thanks, Simon. In a very different circumstances. I missed the lounge.
I know. Tell me about it.
One day
we'll get back in the studio one day. We'll do another proper episode, and once the world regains some normality, because we definitely do find ourselves in very strange times.
Yeah, we certainly do. But yeah, thanks for coming back. It's good, and thanks for the support that you've added to the sector during this time. I think it's certainly a virtual round of applause. You've been a really an instigator of some great things that's been going on in the last 8 to 9 weeks. So well done.
Well, bless you, sir. Thank you. Just doing my bit. I think it's strange for everyone, and we're kind of, as an organisation, we're all very much about collaboration and supporting the sector. So it would be kind of out of character, if you like, to do anything but yeah. I mean, how are you getting on? What's it all been like?
It's one of these things, isn't it? We have to now adapt our experiences and our business models and what we do to the environment that we find ourselves in. It's been tough for us as a business. I think predominantly operating older care home stock. It was always going to be a challenge, and I think you see the rhetoric in the sector that there is a lot more challenges to those traditional buildings, and the way in which the layouts and how you can use things, and you have to be a little bit more innovative. And but I mean, just amazing staff teams, really. You just large proportions of people just pulling together and doing some amazing stuff to support the residents that we've had. And to be fair, we've stayed pretty much COVID free, but there's just so much wider impact of this is what's going to cause for us as an operation and for the sector, that I think, with all the goodwill, which it's still a very, very challenging time, and I don't think we're going to see much let up on that moving forward.
Yeah, it's definitely going to be a gradual, cautious approach from the perspective of the sector and the people, members of the public. I think everyone's been kind of shocked with the set of circumstances. I don't think anyone could have seen kind of the way that it would have play out. So yeah, it's just strange times for everyone, I suppose. So tell me a little bit more about your experience and the experience of your team to date.
Well, it's been a very odd experience, I think, because it's trying to manage this complete moving feast, isn't it? Of so many things having to change, regulations, guidelines, the uncertainty. I think the biggest challenging experience, or the experience that sort of stands out the most, is this. It's the rhetoric of what people are getting from the media to then how that then has to be delivered in an actual realistic environment. And I think we'll probably touch on it a bit later on about actually some of the media presence of care homes has actually had a really negative impact, not only on how we're seeing. Well, it has had a negative impact, not on how we're seeing, but also on the people that work within it. But yet, it's trying to give us more goodwill. So it's quite a strange dynamic we've ended up in. Got more awareness of care and care badge and all those things that Matt Hancock finally realising what's in his job title. But yet, we don't, but actually it's had a negative impact in terms of care homes, because the ultimate thing is that, well, people see it quite negatively. Well, we don't want to place people in a care home, or we don't want to work in care homes. So there was this big thing at the start of when COVID-19, when a lot of things like restaurants and stuff like that all shut down, that we could really push the recruitment side of things and volunteers from other sectors. But obviously, because of that media stigma, actually, you haven't found that. Well, we haven't. We've had lots of applications at the beginning, and then just as the care really started to hit that horrid peak that was in April, you then saw, well, actually, that they're very standoffish. It's become, it's quite a strange place, strange sort of position I think we've ended up in, inadvertently. More awareness, more sort of goodwill. Loads of people really want to and understand the sector, which we didn't have, and it's a shame it took a pandemic to get that. But ultimately, I think we're going to be worse off in terms of people using our services or actually wanting to purchase them, because people forget that ultimately what happens is there is a service that's purchased, and that's been the biggest challenge that we found. Yeah, I don't mind admitting we had a COVID incident in a home. We've lost a number of people, but we had 3 deaths that were associated to COVID-19. All 3 of those people were already in hospital, so we don't know the exact challenge. But that home has had a huge impact in terms of the natural attrition when people sadly pass on, which happens in care homes. We're not saying anything out of turn, but obviously we're not then getting the normal admission rates. So actually the impact on that has been, it's looking at that natural attrition that you would have anyway, but you're not replacing it and replenishing it. So that home is starting to structure, to sort of go through that. And because it's gone through that, it created a fear factor until we got testing, where everybody thought that it was like, oh, it was rife, it was in the walls, it was on the stairs. It was kind of this invisible fear of something you'd see in a movie. So staff would, there was increased self-isolation, there was increased, people not wanting to work and having to then manage situations with those who had shielding family members. And that it became a pressure cooker, that home did, which has only just started to settle down. But ultimately, we've gone from, near 90% occupied to near 60% occupied. It's just like, that has a huge impact in terms of moving forward. But then all of our other sites, we've had nothing. Other than a really bad experience where we had a hospital discharge. Somebody was discharged to us. We had a piece of paper that said that she was negative. We were told that she was negative, turned up, and just as the hospital transport left, oh, by the way, they had another test today. You'll get the results tomorrow. Turned out she ended up being positive. So we just dumped this individual, blessed them for no fault of their own, in an environment which could have just destroyed another home. But because we were so fearful, this was before testing was so readily available. Before this sort of happened, we had these isolation zones. So she was in an isolation zone with 2 members of staff. So fortunately, it never got anywhere else, which was good. And the individuals that were dealing with that individual never, when they were tested, didn't catch anything. But they actually ended up staying in the isolation zone for 14 days. So they didn't go home. 4 kids between them, 2 staff ended up staying 14 days, all because essentially we were just dumped what was essentially to the hospitals a problem that they didn't want to deal with. But obviously that has been dealt with now. This was back in April. But those are some of the experiences that people have had. That it's just like, I don't know, I'm not the only one. And you think that's not really helped us. Yet, you get the whole sort of incubator of a care home. I think that's the main experience, is just the rhetoric and the real life is so far and wide.
Was the person living with you already, or was that a direct admission? So it wasn't somebody that...
No, it was, please, can you take this person, help get us out of hospital? I was like, yeah, well, of course, but we need a test, and we had all that. And it was literally on the doorstep. Oh, by the way, see ya. What?
Yeah, interesting set of circumstances to be presented with. I mean, how did, from the perspective of the team, I know we've spoken a couple of times, and you've been very, very proud of the way that your team overall has responded.
Yeah,
but yeah, I mean, from kind of their perspective, what's your view on the team's response to the set of circumstances?
No, they're just amazing. Just some of the stuff that they've been doing, and the way they've been dealing with it, sacrifice. People not seeing their children and spending time in the homes, covering, people who are shielding or, have NHS letters so can't come to work, making sure that we're adhering to regulations. But the most important thing is their own well-being and keeping staff well-being and things like that. So yeah, I've just tried to keep that up. Obviously I don't, they do all the hard work ultimately. We've had our offices closed and had to go through all those challenges. But one of the most important things I think they've said is that, we had worked hard. We locked down early, very early. It was actually the week of the 10th of March, because I remember it because we were at Pinders. And it was that week, and we locked down literally the day before, Tuesday the 10th, I think, or Tuesday the 9th of March. So we were literally locked down very early, and we had adequate PPE, and we always have done. And we just have always said about good process PPE. And if you are doing that, we know that we've had people actively with positive cases and not transmitted, and that's because good uses, PPE being on top of it. So I think they've really, welcomes that. But then we've also tried to support the wellbeing. So we've been doing gifts. We've been sort of talking to them via our internal memoing system. Like last week we did hand cream, just because all the hand sanitizers, dry hands, we just thought we'd do that. So we Body Shop, and we got like loads of hand cream set out. And, over the Easter period, we had huge, like, chocolate hampers going into the homes, and we've done some bonus stuff. And we just tried to keep people motivated. We had a really good thing actually. We've recently started doing, this was before COVID, but it actually became a really, really good thing. We started working with a soul midwife who's like supports bereavement and challenging about your well-being stuff. And one of the things I was talking to some other operators about was how we don't really, when you step outside the box, our teams deal with death on a weekly basis. Yeah. How do we help actually support them properly with that, with mental well-being, and just in terms of compassionate leave, even because some people could be closer to the residents than they might be to their own family members, because that could be the case. Yeah. As anybody that's in the sector knows, that the majority of people who go to funerals tend to be from care homes, care staff. So we started to implement this sort of soul midwife who talks. And so what we've done is that normally they're face to face, but we transitioned to a Zoom call version of it. So we have staff that do sort of 6 or 7 in sessions where they'll come on as a group and they can talk about what it must be like, and especially with the home where we lost, a significant number of people in. So ultimately we lost double figures in less than 2 weeks, which is just unheard of for us. And it was that, helping them sort of through that, I think has been important, and recognizing how important that is. Even I'm not saying that we didn't do that before, because I like to think we were very focused on well-being, but being constantly aware of that, you've got to make sure that, we're expecting a lot of our teams. Let's make sure we can support them in the best way that we can. But the online memo system that we've got through our rotoring system has been great, because it's a way of me actually having direct message conversations with them. So it's kind of very personal, so I can send them. And I've done like a couple of videos that I've recorded, then I email out like a YouTube link and just talking direct to staff and stuff when I can't get there, and doing video calls nearly every day, which I think a lot of people are doing, and trying to keep them communicated. And our social media has gone really, really crazy compared to what it was, because it's used as our active tool. Facebook is just constant. What is everyone doing in the homes, and the families are interacting with it, and we've seen a much bigger engagement in those technologies, and which we've always wanted to do, but they've kind of just not been there. They've been there, but nobody's really kind of engaged really solidly. But this has made that happen, and I think that when we come out of it, we'll be very different in our usage of technology. I think it will accelerate some of the things that we had in our technology roadmap for this year anyway.
It's an interesting one, isn't it? Because people have had no choice but to habituate to technology usage. This conversation's a prime example of that. Usually we'd be sat in a nice studio having a face-to-face conversation, and obviously now we're doing it in our own homes and doing it over Zoom, which is it's great. It has its benefits, but in the set of circumstances, it's absolutely perfect to achieve the result that you're looking for. So as far as kind of taking positives away from the set of circumstances, the use of technology hopefully will be a little bit more tech savvy, a little bit more kind of efficient in the way that we do a lot of stuff, which is hopefully a good thing that we can kind of take away from this.
Well, we already had tablets in all the homes set up with Zoom and Google Meet already on it, but I don't actually necessarily know how much they actually used it. They were set up purely for that, so it was nice that it was already there. But the amount of people have asked me, how do we use it again? And that's these little training things tells me that it probably wasn't being used as much as we intended it to be. And again, because we have been aided with that, because we kind of set our technology up, because 2020, I think I talked about it previously with you, was kind of our technology sort of roadmap year. We had a lot of sort of technology implementations throughout this year. Some have been delayed because we had 2 that one due to launch in March and another in April, which haven't happened, and they're sort of on delay. One of them with your sponsors, Sequoia. But we were kind of there, like when we closed our head office, because of the way that we were already set up. People just literally lifted their laptops, went home, turned it on, and they were working straight away.
That's the Kimble IT, the people that do all of your
IT. Kimble IT do it, but ultimately it's G Suite. So everything we do is in G Suite. Our phone system's in G Suite, our messaging service in G Suite, all of our data is in G Suite Cloud, in Google Drive. So it's not like we had servers and a phone system. because even though the phones on the desks were phones on the desks, but their Google Voice is on their laptop anyway. So as soon as they got home, they'd still had their phone numbers. So nothing changed. We still talk to each other the way we did. The biggest change is I feel like as a operator, I've had more contact with my managers, because I used to have a monthly management meeting when we all got together, and then it would just be on the phone calls or when I was visiting homes. But because I'm not visiting homes for obvious reasons, going in and out of homes on multiple days, I didn't think was wise. So like last week was the first week I've been to the homes for some time, and it was really nice to go down. And now we go, start going back. But ultimately, we're doing managing calls every day on here. We're talking, and everyone's contributing. We're coming up with ideas about doing this. So actually, it's made me streamline a lot of that. I actually think I've had so much dead time where I thought I was being productive on trains or whatever, but I probably wasn't. Most of the time I was probably just rushing around London. Actually, you realise when spending so much time in London that you don't actually communicate that much because you've never got any reception. So you can't actually, you're either on a tube or you're in an area where, like, if you go to King's Cross, well, before, it's probably great now, but I know at I couldn't even get a 4G. I'd come out and I couldn't even get Google Maps. I'd be like, so maybe it was my network. But you think, well, actually, I thought I was being productive, but I wasn't. I've got so much done from this because I've looked at things that I wouldn't have looked at, and they would have only appeared when something went wrong. But it's meant that we've been proactive with our policies and procedures, and we've been proactive. We go, no, actually, that flow of that information to residents' families is really poor. Why don't we just do it this way? And actually, that person who's normally does that role is better positioned to do that communication the way we're doing it now. And little things like that has been eye-opening, and we've kind of changed loads of systems for the better because we've had time. Some people in the team might think I'm being really annoying because I'm now seeing the stuff that I probably wouldn't have looked at before. But no, that's what I found really useful about it. I think it's been great.
Yeah, I definitely think there's kind of what I was alluding to when I was talking about kind of driving efficiencies through technology, because I'm exactly the same. I spend loads of time traveling around the country. And yeah, I mean, I'm going to go, the travel has a purpose, but our life hasn't slowed down in any way, shape or form. And it's all been technology driven. So it does start to beg the questions. Is it necessary always to do those types of things? Can it be expedited by technology more efficiently, more cost effectively, in a digital format? So I guess it's a question that all people and all business people will be asking themselves and kind of thinking, well, where do we go from here? What can we take from this situation that's going to be good, that's going to improve things as we move forward?
Yeah, definitely. That's what we're certainly going to be doing. Well, we already are doing it because we're getting ready for the new normal, which isn't going to be what it was before. So we just got to deal with that.
Definitely going to be some changes, and I guess we can explore those a little bit later on down the line. But one thing that I would like to understand from your perspective on is, so like initiatives, the fantastic things that the care sector has been doing over the last couple of months. What have been the things that you've rated and that you've been excited by?
I think there's, I don't know how many initiatives maybe have come out of it, but I really liked the scale in which people have sort of moved together. Groups that you and I are part of, where we've got lots of knowledge shared that was never there before. I think has been a breath of fresh air with getting things moving in the right direction. And like I've said before, the sector will always resolve itself. It won't need outside influences to help it. It will just it has enough entrepreneurial and dynamic thinking within it to move forward. I mean, in terms of initiatives that are happening, I think certain ways in which we've handled sort of furloughing and staff shielding and all of those, I think has been quite unique because it's a very different set of circumstances. Because ultimately, we're organisations that are going to continue to be working all the time. So it's how that's managed and how people have worked to continuously employ and then embed new systems to make sure that people can and can't come to work. I mean, it's very similar to a lot of other industries where they've had to stay open, like your distribution, with how we work to make sure we keep people safe when they come into work, with temperature checking, with, good practice of PPE, with strong understandings. But I also think the lobbying element in terms of, I think, the funding questions that have been rolling on for a decade now. I think there are going to be some really interesting conversations around that, because a lot more people are not only aware, but also think there's a tighter knit of people that are going to be able to actively, there's going to be less divide and conquer. Do you see what I mean? In terms of the way in which authorities and governments have done that in the past. So I'd say those types of initiatives, really. I mean, in terms of individual initiatives that are happening in homes, I've loved something like the lookout windows for people to come, like the drive-through testing and stuff. And I recently the sort of the greenhouse visitation thing, I think is really cool. And some people are starting to do individual rooms for how do you get back to visiting. And I think there's been a lot more time within the homes to create their own initiatives, because of the way that lockdown has been, and there's so many less visitors. Because you don't realise until you don't have them. One of my managers said this to me this morning. How much time is spent per day just dealing with visitors that are coming into the home, whether that's professionals, whether that's family members. That's not meant in a bad way, but ultimately she was saying it's probably 35%, 40% of her day is just facilitating some sort of visitor. And they haven't got that, so they're just dealing direct with residents. So she actually made the comment today that she feels like they've put so much more, not that they weren't doing it, but you always want to do more. So it was like around sort of well-being, and in terms of what we do with residents and how we engage, and they've had real time to do that, which has meant that the internal sort of love and sort of association engagement with residents has become so much better. Not, I'm not trying to say it was bad, but you know what I'm saying? It's just, there is serious enhancements from being, and I think because lockdown measures are never really ever going to be the same, we're never going to just flippantly be open to residents. I don't think, we might be saying something different in 2021, but certainly between now and the end of this year, I can't imagine that we're going to have the free flowing door that we used to have, because it's just, I can't see how it's going to work. So I think those types of things are quite important.
Yeah, definitely. And it's good to hear kind of how people are facilitating, supporting their residents in different ways, so that they can engage with members of their family and from kind of the outside worlds in really, really innovative ways. I think one of the challenges in the care sector, even when people are in even good quality care homes, I think people are always at some level of exposure from isolation and loneliness, just because of the kind of the nature of either their kind of family dynamics or whatever the kind of the cause is, if you like. So people looking outside of the box to be able to create solutions for that, I think is well, firstly, it's very important, but it's good to see that people are making some real positive steps. And as you say, there's been quite a lot of great ideas where I've kind of taken a step back and gone, that's awesome. That's really, really good to see.
Yeah, absolutely. Yeah, it really is. Yeah, it's been good. It's been good from that perspective, I think. And I'm looking forward to seeing how that's going to play out. I'm quite apprehensive, but excited about how it's going to play out in terms of as a national programme.
I mean, that's one of the things that the media has actually been quite good at picking up on. So where they have seen stories of people doing quite innovative things, they've done a good job of picking up the kind of various different stories and things. I think most of the innovations that I've been made aware of have been an operator getting in contact, sharing a news clipping, and saying this is what's going on in our home. And I'm delighted to see it. What you kind of touched on it a little bit, but tell me a little bit more about your view on how the media has dealt with the COVID set of circumstances relevant to the sector, because there's been a range of responses, let's say. But yeah, what's your view?
I don't know. I'm kind of a bit. I'm careful what I say, really. I mean, I don't think that there's been certain elements that have been good, i.e. raising awareness, but it lasted like anything. Good news isn't interesting, apparently. And I just think that there's pockets of stories that are out there, but ultimately they've raised the profile and then tried to attack it. That's how I feel. And it ultimately is going to play out with, look, if people were making a decision about putting a family member into care at the moment, they're not going to do that. It's just a fact. They will always have a different decision. And that has been, so, it's our responsibility as operators to go, this is what new normal looks like and how we protect and ensure that people don't be, will not have the challenges of something like this. But you can't say that you're going to, because we've always been good at infection control, because that's what we do for a living. We have infection control environments.
Kind of part of the day job.
This is what it is. It's something that was unprecedented. It didn't exist, and we're having to deal with it. It's it's the new Brexit, isn't it? So when you've only, it's just there's only one thing that's at the front of everyone's minds. That's not to play it down, because it's absolutely right that it should be. I just think that the care homes are never ever going to be able to sit at the top of a press as something positive, and I think we're always going to have to work our way through those challenges. But ultimately, we have to make sure that we're reassuring those people that are going to be making a decision about a care journey at some point in the next 6 to 12 months, because that's where the biggest challenge is going to become. So I don't think the handling of it has been the handling of it. It's nothing short of what I expected it to be. And I'll be honest with you, to a certain degree, I don't listen.
Have you zoned out from a media perspective then?
Oh yeah, I don't. Yeah, I wait to hear what's actually the crux and the facts behind stuff. But I've always been like that. I'm much more interested in the facts behind a decision than because look, everyone can say anything that they want about whatever's happened, but at the end of the day, it's unprecedented and there's nothing that sits behind it. So you just you play the cards that you think are the cards to play at that particular time, and some might be right, some might be wrong, and we have to. Those are just part and parcel of it. I think unless there is a reason to be overly critical, then I think that we should just we just put it down to the situation and have to move forward. I don't think there's any other way, because nobody could say that they would make any decisions differently based on the same scenario, because nobody really knows what the scenario was. So you've just got to
That's an interesting one, isn't it? I think that a lot of people have been criticised for doing lots of different things, and I keep on in some sets of circumstances, I do think that criticism has had some merit. Equally, in other sets of circumstances, I've kind of thought to myself, I'm not sure many people would have done a much better job, all things being told. But you touched upon there, kind of looking to the future and kind of how things play out. I mean, what's your view? Like, how do you see things playing out?
Well, I think we're just going to operate a different business model. We're going to be very much aware about, it's going to expedite some of the things that we were looking to do anyway. We're obviously looking at engaging in our home care product, which is slightly different to the standard domiciliary care service, which was due to launch in June anyway, but obviously slightly delayed. But, we are going to put focus around wrapping diversified services from our homes, which was always our business model moving forward. I've talked about before about how I view care as a holistic approach, and operators must do multiple functions of care. It's just going to accelerate some of that, because I think, focusing purely, and people will say different, and that's fine. Everyone's welcome to their opinion. But I think vanilla care settings that just purely do delivery of one type of care will find it difficult for the next year, because I just think admissions are going to be few and far between. And there's nothing to tell me that statement is incorrect at the moment, other than if you see a raft of operators leave the market because of it, which means then it reduces the amount of spaces for the slightly lower demand that's there. But I just think we need to be talking to and engaging with people sooner in the care journey than maybe we did before. And we need to have much more process of reassurance, and we must have much more focus on how we manage our care interactions, our training, our well-being of our teams. And I think that has to run through our services, and that just has to be part of what we do, even more than what we did before. But ultimately, I think we're going to see a transition of certain people who maybe were going to come into care that wouldn't come into care now at that particular point. So we maybe need to, work out how we're going to join that up differently. And I hope, and this has been a passion of mine for a long time, that there is better engagement with how we engage with health. And then there is much better throughput of people not being in hospital, where actually, especially in the elderly OP, which is obviously where we focus most of our attention, is not the right place for people to be. Whether you like it or not, somebody with severe challenging cognitive dementia being in a hospital is not a good place to be. There, you need to be with care staff who understand what it's like to deal with those residents, and understanding that it's a profession and they have a good knowledge of dealing with people like that, which actually the hospitals, I'm afraid to say, do not.
It's definitely, we could create an entire podcast literally just about health and social care and how the two could
Yeah, I
integrate
don't think
together.
it's going to change a great deal, sadly, as I think a lot of people have said. But I mean, if the time isn't now to try and push it as hard as you can, there will never be another time that we can. So we may as well see if we can move the yardstick somewhere.
Definitely. As you know, I posted one of my things. I promised myself I was going to up my game from the podcast. What I've started to do is to let people know who I'm going to be interviewing and ask them what their questions are. So I've got a couple of questions, kind of from a ask the audience type perspective, if you like. So the first question, which is quite linked in with what we've just been talking about. So this is from Sarah Willits. So she's, I believe, the regional director at Abbey Healthcare, and she asked, so care home demand is likely to change as a result of COVID, as we've been discussing. How do you see this impacting the provision of care in the future?
I think it's going to impact it for a couple of stages. So number one is, again, about that first 6 to 12 months. I think there's going to be a quandary in decision making on whether people are going to place in care. I think at the moment, with so many people furloughed and so many people working from home, and the fact that people are having to self-isolate for long periods if they're elderly or vulnerable, I think there's not a necessity to make that decision if they need to go into care homes. As such, if they're already receiving care in their own home, and they may have then thought that there may be a care home, those things, I think all those decisions will be delayed. But I think once you see people come out of furlough and we get over that bit, I think that might see a change. I think in terms of the demand, it will be very much down to the operators that are pushing forward to go, it's like a standard message. This is how we look after people. So that there's an awareness from day one, and people will get that reassurance back. And I'm hopeful that we will just find a different movement in sort of how we deal with. So there's been this is a hope more than a thought. I think it would be because we've seen such a desire to access care, and that will sort of channel through the local authorities. I don't know whether we'll see a shift in the private and local authority market, where we might maybe see a slowing of certain private decision making and an increase in operators accepting properly funded local authority, because now the throughput of funding might be different. But maybe it's just wishful thinking. There are probably some people that listen to this that have done this longer than me and say, you're on hope and air there, Adam. But especially with some of the local authorities that we've worked with, they've been brilliant. And that is, I'm usually a basher of the local authorities. Certainly one in the southeast I've dealt with for years, and they've been brilliant. £2.7 million worth of free PPE, 2 weeks worth of money. The £600 million funding coming straight through to providers. It's like 6 figures worth of income. Now, if they don't see that it's needed for, once they see the dissemination of the information that we have to provide of why that funding was provided, I think that if then there is a different discussion between government and local government, or whether we start seeing a move towards this single country fees, which I think a lot of people have talked about, and I certainly have for a long time. I don't see why, in my postcode, like we talked about in the very first podcast, I don't see why we're paying, if you live here, you pay more for care just because of supply and demand. It should be about service. And hopefully this goes down that road. That's what I want to see pushing. So as a result, I'm hoping that you'll see more of a balance in that funding, which means more operators can work with more local authorities, which means there is a different skew in the supply and demand, which then forces the Care Review Act and the Green Paper. That's what I'm thinking. I'm hoping, but maybe, like I said, people might disagree with me on that. But that's what I think the provision looks like. We'll see a slowing for 6 months. Sure.
Well, it will be a fascinating podcast in six months to see, kind of, to review the situation, then just to see where we are. So Sarah actually had two questions, so I'll make sure I ask that before we move on. And we touched upon this just a little bit, but so what are your views around how resident visits will be conducted as we move forward? And I guess I'll add into that kind of what do you see as being great ways of being able to conduct resident visits?
I think we'll think about, especially in design of buildings, a lot more utilization of outdoor space, sort of like balconies and bigger viewpoints where people can meet outside rather than inside. I know that some of the teams in sort of new building design, especially ones that I've been to, with these great sort of outdoor indoor spaces that they've got. Majestica have got a great example of that at one of theirs. They won the Pinders, actually. This really lovely sort of upstairs period. Yeah, Cavendish Place. They've got this amazing period piece upstairs, which is like inside outside, which I really loved. So I think there'll be a lot more drive for that. I think that there'll be, how you utilize your space within the buildings for accessing visitors. And I think, well, in my personal opinion, is it will move a lot more towards sort of appointment-based visitation. So, let us know when you're coming. This is the process behind it. We manage how you enter, how you exit, what parts of the building you're allowed to go to. And that just becomes standard practice, and being very rigid on people's health. Because we lived in a world where if people weren't very well, they just carried on with normal life. That is what will change. It will just change. We just won't do that. If somebody has a cough or a cold or a sniffle, you stay at home. If you're able to keep working, then work from home if you can. But if not, you don't come to work. And that's just the world that we're going to live in. And it'll be the same visitation. And then we'll have like these different pockets of how we do it. And I think then it'll encourage a lot more outdoor visitation, maybe families taking family members out and doing more engagement externally. And those types of things, I think that's what we're planning to do anyway, a lot more of that.
People spending more time outdoors is always a good thing in my mind. It's probably one thing that just as humans, from a well-being perspective, that we should all try and spend as much time outside as possible. So that can't be any bad thing for sure. Next question. So this is from Jamie Stewart at Clydesdale Yorkshire Bank, soon to be Virgin Money for Business.
Yes. That's right, yeah.
As the deal obviously went through, I think it was this year or last year, I can't remember now anyway, but eventually Clydesdale in Yorkshire will be Virgin Money for Business. So Jamie asks, so what's your view on track and trace, and how do you see it impacting staffing?
Yeah, it's an interesting one, because he was talking about this with some operators this morning. I mean, I'm probably going to sound a bit flippant, but that's what I do. I don't think it's going to change a great deal, because if you actually look, it should be better, because actually at the moment, before we had testing, if there was any slight uncertainty, we're like, well, you got to self-isolate. So we were doing that anyway. So this would just give us more certainty. We will control, we have our own testing ability. We test people. If they end up having, because we've had it recently where we've had senior member of staff had to self-isolate because somebody that lives with them was tested positive. So they had to have 2 weeks off. I think it's just going to become part and parcel of what we do. And it will just give us a better awareness of it so that we can manage it. And we're just going to have to build that into our rotoring and say, we're going to have to be more fluid and encourage people to support when others, all of a sudden, at the drop of a hat, might not be able to come in. And we've just got to be, as ourselves operators, better equipped. We've always done the shift swap system. I don't know if I've talked about it before, where we encourage people to cover each other's shifts by rewarding them for doing that and putting the responsibility in their hands. So if you don't want to do a shift and you want to cover it and you want to swap it with somebody else, you don't talk to any managers, because you think everybody's responsible enough to do that themselves, as long as they do it. And the person that says, yes, I'll cover that person, gets paid bonuses for the hours that they do. It's just no agency, not rocket science. Everyone's happy. No headaches, no text messages last minute. So I think because we've embedded that culture, we will try and go down that route of saying, encouraging people to support if somebody at the drop of a hat has to go off. But I can't see it. I think it'll be a good thing. But 10,000 calls a day is the thing that worries me, is you're creating a manual process. And what do we all know about manual processes in this world? They're not terribly effective. So
No.
I'll wait to see how the app sort of works when that comes out, I think.
Yeah, it'll be interesting to see kind of how it all kind of pans out. But interesting to hear your view from a staffing perspective, certainly. And I think if there's one thing that the social care world could learn is taking a more dynamic approach to making sure that shifts are covered. I think that a lot of people are making some really, really positive steps towards making sure that they can kind of minimize their exposure to expensive agency use and all of that type of stuff. There's probably an awful lot of, I mean, that's probably another thing that we could just create a whole podcast on, literally how to address that, because it is, I mean, it's one of the biggest bugbears of the leaders of the sector, not just from a cost perspective, but then from a consistency of care perspective as well. So yeah,
we've always worked really hard to try and encourage people to stay within the consistency and the confines. But, you know, I've said before, we're a smaller group, so it is easier as we grow. But I'm hoping that cultures like that are quite important, just giving people the responsibility to look after themselves, because actually it just works better if you can avoid your agency where possible. It's so much. Well, look where we are now. You're not going to be using you don't want to be using agency at the minute because you can't guarantee where people are being. So actually, we're actively encouraging people to be using less agency anyway, which is, you know, I've said for years, I think is the right way to do it. I'm not a believer in working with huge agency usage, and people that do, you know, you need to be looking at solutions of how to fix it.
I like the approach around almost creating an environment for people to their natural default position is to take ownership of the position of the situation, to be able to encourage other people to cover the shift, and then it's less time for the manager having to deal with it, and then the team feel likely they're going to feel more fulfilled in doing that anyway, because they know they're not pestering their boss, they know that they're not kind of being burdensome in any way, shape or form as well. So I think that makes.
Well, we coined it the birthday party policy. Because
Okay.
what it basically meant is that you could, if one of your mates was having a birthday party on a Saturday night and you wanted to go out, then go out. Because what you'd find would happen is 10 minutes before the shift, you get a text saying, "Oh, I'm not very well." And then they'd have photos on Instagram or Facebook that some of the other staff would see, and then it'd be uproar about, "Oh, they just went out and got drunk," and all that. And that's physically happened. So that's why we did it, because you just said, well, you're allowed to do that. If you want to go out and you want to go out with your friends, that's fine. Just cover the shift yourself. That's fine.
It's quite funny though, because you're in a slightly tongue-in-cheek, you're kind of calling them out on it before they even do it. So
yeah, right. But somebody's going to get more money for doing it, and we don't have to call agency 10 minutes before the shift and get somebody that residents don't know.
Yeah,
it's not rocket science.
Yeah, definitely.
Anyway.
Thank you to Sarah and Jamie for asking the questions as well. I'll be looking forward to answering and asking and getting involved in answering the questions from future people who chip in with good questions as well. So thank you both very much. I've got a few more questions. So my next question is around, okay, so what are the top 3 changes that you've made so far that you're going to carry on doing basically in the future? So what are the things that actually, that because of COVID that you've had to make these changes, but actually in kind of moving forward, they actually have real validity and are a better way of working kind of as you move forward?
Our collaboration with our managers, actually giving them more time to knowledge share rather than meeting quite irregularly. Well, not regularly, but quite big spaces between them. You know, the weekly and virtually daily video conversations will certainly continue and grow as the numbers do. Our engagement with residents and residents' families, we've actually found that we communicate with them more than we did before, because it was just based on whether people came in and out for if somebody came in and out for a conversation or a visit. So it was actually actively, because they got coming in not able to visit you, communicating with them. So I think that those are certainly things that we knew. We didn't think we were doing a bad job until you realised the job that you were doing wasn't very good. Those are some of the points that we certainly will, and our effective communication with the wider team as our team members, and actually keeping them much more up to date, and the way in which we've sort of reverted our training, because obviously we're still doing our training, but we did a lot of face-to-face sort of stuff, and we've moved to a much more sort of collaborative online based training system, which has enabled people to train. So we used to have, people would have to come in on days off to do training, and we were never really a big advocates of e-learning in certain ways, but we've kind of engage with this platform, and then adding some of our own bits that means that people can sort of do that training and keep abreast and do it at their home at their own leisure if that's what they would prefer to do. And we found that that's been really important. So just these little nuances, and knowing that, not being afraid of those technologies, just crack on because they are going to make a difference. I think that's it.
I think from a tech perspective, I know I've kind of talked about this already, but the world was going in the direction of more increased technology utilization, and it's just, I guess, it's forced the set of circumstances, and I hope for the good as we move forward as well. So no surprises there then, and that's going to make up quite a big part of the way that you approach things moving forward. So what do you think the biggest lessons that I guess kind of you and the sector have learned from the whole COVID set of circumstances, if you like?
That we do a damn important job, and we should be respected for that. And gone are the days of the I think I've mentioned to you before, like, I was sometimes afraid to tell people what I did for a living.
Really? Wow. Okay.
Yeah. Like, people asked, it was always, I always felt like I was not saying, I operate care homes. It was kind of more, we do these services, or I'd kind of just not really talk about it, because I always felt that people had such a negative view of it and saw you negatively for operating. But I don't know why I did that. I know, at least we weren't being honest. I did feel that, because you were made to feel as if it wasn't but it should be, it's getting that sort of being, it's a really important thing, and really proud of everything that we've been doing as a sector. And that's, we continue to do more of that.
Definitely. I think it's an interesting one, isn't it? Because there's so many people in the wider healthcare world as well, but social care's kind of almost just as guilty as this. I think it's a really, really humble sector. And I think because it's humble and kind of underplayed, the natural position of an awful lot of people in the sector isn't to be really kind of, not to be like braggy and kind of over the top with that type of stuff, but even just like an appreciation and recognition of the fact that the sector does such incredible work. I've had it before. Yeah,
and also there's a level of respect. I know this is going to be, the respect all should be there for the frontline workforce, but there is a huge, I don't think people really appreciate as an operator, and the operators who listen to this will hopefully agree with me. But if you're an owner operator, people don't understand the risk that you take in doing this as a business. It's huge outlays of money and huge debt, because it's buildings, it's provision, it's a challenging environment, heavily regulated with huge amounts of risk. And every business in the world has a risk versus reward strategy. And it feels like everyone's happy for us to take the risk, but not happy for us to then see the reward from that risk. And I think there has to be, a bit more of an appreciation for the fact that there is the owner operational community work extremely hard, just because they're not in the buildings delivering that front line. There's so much goes on in the background to enable homes to be able to be there in the first place, because they're incredibly complex businesses without people people don't think that. We've seen things in the last few months, haven't we? We've posted online like silly comments about the amount of money that people pay to be in care homes and things like that. And, I don't hope you don't mind me talking about it, but I just think it's just a lack of understanding of the fact of how much risk and how much it costs to be able to deliver this in environments that you do for people with challenging behaviours. It's you don't know what it's like until you do it. And I think that's real big important lessons for what the wider sector and what we need. And we need to use this as an opportunity to get that external community understanding of what we do, and that will help rebuild the reputational damage that we may have seen despite this improved goodwill but bad reputational damage. It's kind of like a really weird skew that we've ended up with. But that's probably biggest learnings and most important lessons, I would say. And some positives. That is the positives, is how we then take it forward as a professional sector that we all are proud of.
Definitely, without a shadow of doubt. Okay, great. Last question just before we wrap things up. So what is your number one recommendation? Okay, so for people that work in care, whether in a kind of in a frontline capacity or in a leadership type capacity, what's your number one recommendation for people in the care sector moving forward for the next few months?
Well, I'm going to have two recommendations. Number one recommendation is everybody must be part of a care workers charity.
It's a strong recommendation.
And get yourself some t-shirts as a minimum, having gone over £1.6 million raised for care workers this week. But number one recommendation to frontline is just there's no words. They're just some of the people that we've had are just amazing. The number one recommendation is for owners is let's keep pushing to professionalize that status and not giving up and relying on the sector to help heal those that are suffering in a way, because there are going to be home operators, single home, ones and twos operators that, with older stock, if I'm honest, I think will really feel this pressure in this short term, regardless of whether they've been COVID free, just because you haven't got those economies of scale to kind of manage your way through it. But the sector is there as a whole. Reach out to people. The group that you set up, Simon, that we're all part of, has just been immensely useful to us all. And just something for me, just a bit of mental well-being in a way that there's other people going through it. And the fact that I've had people who I didn't even know just message me through it. Gareth over in Belfast, just like never spoke to him, sent me a message outside the group when he found out that we were struggling with a COVID outbreak like that, and we ended up having a private conversation. I've never met him, but I hope
nicest guy, literally nice.
Yeah, I hope to do so when this is all over, and well, not all over, but when we are able to do so in a different capacity, hopefully an event that comes back on, because that's one of the things I'm really missing. I was talking to Neil Eastwood about this the other day. About the fact that we're missing the events, the care show and the health investor, and they're just such those moments of things where actually it is okay for us to celebrate the great things that are happening, what we do as operators as well as frontline. And I think trying to be continue to push and grow those types of things, I think will be really vital. And I think these little communities that have created have accelerated things that were happening already. When we've seen the sector become a lot more collaborative, I certainly think so in the last 5 years. I've only been in the 8 years, but the 3 years to the 5 years, this is a massive difference in terms of this sort of collaborative centre of people that are willing to support and provide. And, I think there'll be times where, it might be an operator does get to a point of saying struggling, but it might be that another operator might go, well, actually, why don't we come in and take that off you at the right time, rather than it getting to a point where it goes to a bank or becomes a much more challenging period, and we can maybe have much more open dialogue about things like that and be much more supportive. And that actually might add value to somebody who actually says, look, 6 to 12 months is looking pretty bleak, so maybe let's get into some conversations now that we wouldn't have had before, because the sector will ultimately resolve itself. So I don't know whether that's one recommendation or a closing statement. It kind of sounded like a bit, but ultimately I think that's some of the things that we could be really, really, really keen to continue to do.
Excellent. Well, I can't think of a better way to wrap things up other than that. So, Adam, a pleasure as always. So this was recorded on Friday, so have a lovely weekend, sir. This will go out on Tuesday, 2nd at 7:30. So yeah, it's a pleasure to see you again, sir, and we'll no doubt catch up soon.
Absolutely. Thanks, Simon. Really appreciate it.
Very welcome.